coming away. Rolling. Welcome everyone to another wonderful episode here, just Podiatry. Very interesting case. We uploaded a video I think it was either earlier this week or last week, on a procedure we perform here in the office for flat feet. This is a very young man. He's 10 years old. And Dad has brought the patient here today for evaluation. The patient, about 7 years ago, the patient and family went to see another physician who recommended some bracing devices. And, you know, Dad and myself were talking that it was sort of, unfortunately, they were unsustainable. It just kind of wasn't working out. Am I correct? Mm-hmm. So, during the course of the last 7 years, you know, not a whole lot has been implemented. You know, there's no question that Dad has a flat foot, but not as bad and not as severe as what I'm going to present to you guys today. Now, the patient is an excellent, until proven otherwise, is an excellent candidate for the HyproCure minimally invasive procedure. Let's take a look. So, bilateral, left and right, flexible, flat feet. Mind you, again, to refresh everyone's memory, he is 10 years old. His rear foot, all of this, as everyone can see, the entire rear foot is rolling in. And what I was explaining to everyone last week, because of the procedure that we performed, was this is normal. This is happening. So we need to bring back this bone, the talus, back to where it belongs. This is happening. We got to realign it. And how do we realign it? Using this HyproCure little implant. He's an excellent candidate for this procedure. Now, there's also something else that we're going to talk about. I'm going to speak to Dad about, because he also has a little bit of a limp, a little bit, right? So we have to first figure out, where is the little limp coming from? Is it the knee? Is it the ankle? Or is it the hip? Because everything is connected in one way or another. I don't think it's the ankle. I think it's coming from, or even the back, right? I think it's coming from somewhere else. Regardless, that's number one. We're going to go ahead and send the patient to a dear friend of mine who is an expert in pediatric orthopedics to give us some more intel on where is that limp coming from. And once we know the answer to that, then we're going to be able to safely say, okay, let's go ahead and focus our efforts on taking care of this. Why do I feel so passionate about this issue is because he's only 10 years old, And as everyone knows, we're very big on prevention. Maybe when he turns 15, 16, 17 years of age, what we see here, his ankle, try to turn your ankle a little bit, maybe here. And then in another 5, it may be even lower, right down to here. So we want to keep him and keep all of this medial column, right, all of this nice and straight. This is gonna, if not treated accordingly, the clinical presentation, both left and right, will create a significant amount of pain, number one, instability, and it will affect his daily life activities. If he was if they were my family members, that's exactly what I would say. And this is exactly what we would, what we would do. Pediatric orthopedic doctor to first identify what we just discussed, and then her give us the blessing, and once we get that blessing, then we can definitely focus our efforts on correcting the flat foot using the HyproCure implant, which is a minimally invasive procedure that we perform here in our office-based surgical suite. Hold on to this. Hold on to this. Let me have your foot. Bend your knee. There we go, man. High five. Foot five. Like always, www.jawspodiatry.com, Instagram, Dr. Tojam, Jaws Podiatry, Facebook, and last but not least, our YouTube channel, Jaws Healthcare. Like always, thank you for watching.